positivity rate of 11.08 and 6.37 on the cumulative rate. There's a little over 302,000 people that have recovered from COVID. You know, this Delta variant or now this Omicron, oh gosh, never mind, you know. But there's 605 people hospitalized, 208 people in the ICU units, and 114 on ventilators. With 6 green counties and 18 red counties, there's 24 outbreaks in our schools in 16 counties with 280 confirmed cases. We're joined today by 2 beautiful ladies and our Secretary Bill Crouch with our DHHR. You know, these ladies that are here are Ann Erling and Dr. Cynthia Persley, and she's with the West Virginia Higher Ed Policy Commission. And we're going to make an announcement right now that is unprecedented by any standard. You know, when it really boils down to it, we had those extra dollars on the CARES money, and we thought an awful lot of how is the best way for us to be able to use these that not only gives us the assurance and the boost that we need in West Virginia, but it could very well set an example and be the project or be the eyes and the ears that could absolutely start a movement all across our country. With all of that, we know that we have an incredible shortage of nurses in West Virginia, do we not? And with that, we have all kinds of statistics. Get this, last year alone, 1,700 West Virginia nurses didn't renew their license. Last year alone, 1,700 West Virginia nurses did not renew their license. 68% of those said the reason they didn't renew their license is because they were just plain tired, just overrun, absolutely understaffed at our hospitals and overrun, pushed to the very limit. 1,700 nurses did not renew their license. So today, we're announcing right now a really aggressive program, a program that is now going to bring in 3 more of our institutions in this state: Concord College, Glenville State College, and Bridge Valley Community and Technical College. We're going to aggressively recruit, and we're going to aggressively staff and make every effort to train more and more nurses in the state of West Virginia. Surely, some will migrate out of our state. There's no question about that. That's not a bad thing. That's not a bad thing. We have all kinds of initiatives and everything within this, and the folks that are here are going to explain more about it, to recruit people to West Virginia, entice people with incentives and whatever to come to West Virginia. But not only that, to train, to absolutely produce more and more quality nurses in West Virginia that will give us the staffing that we need, no question about that. And retaining them, there's all kinds of incentives to have them stay in West Virginia. But in addition to that, it is to train and make many, many more qualified, absolutely great nurses within this state. Can you imagine where we are today? 1,700 didn't renew their license. 1,700 in a year because they can't, most of them, 68% of them say the reason is because they're worn out. They've been pushed beyond the limits. They absolutely can't do anymore. They can't do anymore. So with this, we're going to spend $48 million to attract, to train, to teach, to do all the things we need to do, and we're going to do that at 3 of our absolute select institutions in this state, along with the other institutions that are doing this work every day. We're going to, in my hope, we're going to flood West Virginia with quality great nurses that don't get tired, that just do the great work that they do every day, that absolutely are, rejuvenated in every way by our commitment to do something with the CARES dollars that will produce a multiplier effect of those dollars within our own state. Well, it will not be a one-time spend. This will be a renewing absolute multiplier effect of dollars within our own state that will perpetuate our economy, but more than anything, will give us just what we really need right now. We need proper staffing at our hospitals. Now, before we go in to these great ladies here that are going to explain more, or Secretary Crouch, I want to just read you just this. Now, this just came from the Hospital Association, and this is a quote, and I want to read it to you. Projections show that for the 2021 holiday season, we will approach the highest number of COVID-19 hospitalizations in West Virginia since the pandemic began. The vast majority of the patients in the ICU units or those that are on ventilators are unvaccinated. And the national shortage of our antibodies has greatly restricted the access to an effective treatment option. Now, I'm going to stop right there just a second. Now, just think. Projections show that the hospitalizations are going to be at a record high from when the pandemic began. And also that the overwhelming majority of those that are in the hospital are unvaccinated. And that there's a real shortage of the antibodies that offer up a treatment option for those folks that are in the hospital today. In addition to that, we are seeing high numbers of patients with other medical conditions requiring hospital care, such as the flu, heart diseases, cancer, and trauma. So in other words, our hospitals are completely filled up, and we're seeing all kinds of other needs that we're not able to get to. This combination has strained the healthcare system and now, after nearly 2 years, the system is nearing a breaking point as healthcare workers are mentally, emotionally, and physically exhausted. Now, that just came from the Hospital Association. Does that not back up exactly why this announcement today of a commitment of $48 million at these three institutions and all the different things that we're doing for recruitment and on and on and on? Is this not testimony to exactly what we ought to be doing? And I love it that the fact that this $48 million will renew and renew and renew from an economic impact within our state. And if our state can be the leader again, and we can spend the money wisely as we have over and over. You know, along the way, there were a lot of naysayers that said, Governor, you should do this and this and this with the monies and everything. And along the way, what did we do? We minded the store exactly how the store should have been minded. And what we did in all of that was we spent the money wisely. We made the right choices. And now we have a few bucks that are left over from that. And absolutely, we want to commit that in this direction right here, to give our hospitals within this state the adequate staffing that they truly need, to absolutely make and create an atmosphere where our nurses renew their license, happily renew their license. They don't have 68% of those that didn't renew say, just can't do it anymore. I've tried as hard as I can try. I'm pushed to beyond the limits. I can't do it anymore. Now, so with all of that, we're still not through this, are we? And we really better pay real attention to the fact that this quote right here from the Hospital Association says basically one more time, projections show that we're going to hit the highest of all time numbers in our hospitals. The vast majority of the people that are in the ICU units or in the hospitals or on ventilators are unvaccinated. We're running out of antibodies. We don't have enough to give, other treatment options that we could really be of benefit. We're seeing people come to our hospitals today for heart attacks and whatever it may be, trauma, whatever it may be, and we may not have a place for them because we're getting to the point in time of being overrun. This has strained our hospital care system now after nearly 2 years to the point that it is at a breaking point. And the healthcare workers are mentally and emotionally and physically totally exhausted. What better time could there possibly be for this announcement? So I'll turn it over from there to these great ladies, and then we're going to go to our college presidents, and it's a good day in West Virginia.
Thank you, Governor. Under your leadership and direction, we have worked with our different agencies, and what we found was we had a siloed, fractured approach. Everyone had an idea of something to do, but not necessarily a comprehensive approach with everybody pulling the rope in the same direction, as you would say. And that's what this plan is doing that we have put together. We've worked with DHHR, we've worked with HEPC, we've worked with the West Virginia Hospital Association, and I think we have a good, solid plan. Our goal is to have more than 2,000 nurses produced in the state of West Virginia in the next 4 years. Cynthia, I'll turn it over to you. Thank you.
Thank you, Ann, and thank you, Governor Justice. This is definitely a historic investment in nursing, in our nursing workforce for the future for West Virginia. I think it's always been true, but it's been especially visible and true over the last 2 years that nurses are the heart of our healthcare system. Their work and dedication are invaluable. And as you said, the COVID-19 pandemic also has highlighted the critical shortages of nurses that we have in both West Virginia as well as across the nation. So we have to do more to build up our workforce so that we can more strongly support the nurses we already have, who are stretched so thin, and to ensure a stronger workforce for the future. Through this monumental investment, Governor, we'll be able to implement and expand key nursing education programs, including fully funding the successful West Virginia Nursing Scholarship Program to support students who are pursuing nursing careers in West Virginia, by developing a nursing faculty loan repayment program so we can encourage our nurses to pursue careers at our schools of nursing, creating the workforce for the future, and significantly expanding our capacity through all of our nursing programs, both LPN and RN programs. And today we are highlighting 3 such expansions at Glenville State College, which will open a joint program with Marshall University, Concord University, which will open a new program, and Bridge Valley Community and Technical College, where we will open and we will expand their successful programs. The presidents of these institutions, as you said, are here with us today, and Governor, again, we would like to thank you for this remarkable investment. We are ready to get to work, and we believe this is a tremendous way to strengthen our West Virginia nursing workforce for the future and to secure the health and well-being of all West Virginians. Thank you, Governor.
Thank you so much, Tom. Okay, Jordan.
All right, thank you. We'll now hear from the president of Glenville State College, Mark Manchin.
Thank you very much, Your Excellency, Governor Justice. No words can adequately convey how I feel about today and what this means to central West Virginia, particularly rural West Virginia. As you're well aware of, Glenville State College is a very rural college that attracts first-gen college-going, lower socioeconomic students who are given a chance, who, when given a chance, will be successful. So we're excited about this opportunity. We're excited about getting ready. And I want to say thank you to Governor Justice for taking this initiative. It's going to make a real difference, clearly for Glenville State College in working very closely with Marshall University, but specifically for the state of West Virginia and what this means to all of us. So it's with a great deal of gratitude that I say thank you. I'm looking forward to getting started in the fall of 22, and that we can start producing those nurses that are so critical to the future of our state. So let me again say thank you, Your Excellency, Governor Justice, for this initiative.
Thank you. And you know, and I hear nothing but phenomenal success stories about what you're doing at Glenville now, and a great school, and you know, and I congratulate you. I thank you for all your great work.
All right, we will now hear from President of Concord University, Kendra Bargas.
Good afternoon. For over 150 years, like Glenville, that's also celebrating their 150th, Concord has worked very hard to educate and meet the needs of West Virginia with teacher education, business leaders, social workers, and many more professionals. As we all continue to navigate the life and the challenges of COVID-19, the demand for healthcare workers is greater than ever. Concord University is very grateful for the opportunity to again serve the region and the state by establishing a nursing program. We have a planning team of administrators, faculty, and staff who are working right now to map out the specifics of the nursing program. It's a new addition that I hope will lead to other allied health degrees in the future. I want to especially thank the governor, our legislators, the Higher Ed Policy Commission for the incredible work they've done. And they've helped us also along the way in beginning the development of this program. Like Dr. Manchin, I can't tell you how excited we are to be able to create a Concord nursing program to further support workforce goals in the region that are so important, along with supporting healthcare needs and economic development in Southern West Virginia. I want to thank my administrative staff and the faculty who are working in the development of the program and for finding ways to provide another high quality program that will serve the region. This is Concord's 150th year, as I said again, and the nursing program is going to be a significant addition to our curriculum, and I cannot tell you how excited we all are. I want to thank you especially, Governor Justice, for making this happen at such a special time. Thank you so much.
No, listen, how many times have I been to Concord? It's just limitless almost, you know, and everything. And what an incredible school, incredible work you guys do. And Kendra, thank you for all you're doing every day.
Thank you.
Finally, we'll hear from the president of Bridge Valley Community and Technical College, Casey Sachs.
Thank you all so much, Governor Justice. This is a really big deal for Bridge Valley, and thank you for selecting us. I think it really represents the faith that you have in our institution. In the last 30 years, Bridge Valley has already produced 1,000 nurses for the Kanawha Valley who are currently working in the Kanawha Valley, and we are really excited to be able to produce twice as many nurses as we currently have. Our nursing faculty are absolutely some of the very best in the state, and we're all really excited to be able to expand the program and do more good work for the people of West Virginia. So we greatly appreciate your faith in us and are excited to work with the state to be able to expand our program.
Well, Casey, listen, you guys are already doing great work. That's already all there is to it, but we're just going to expand upon that and just keep doing the good stuff. I mean, you know, we got so many absolute diamonds all across this state. And you know, the world is awakening to see just how good we really are. And so let's just keep at it, and let's just keep doing the good stuff. And so thank all of you in every way. And you know, now y'all got the ball. Let's go run with it. Let's do something. Let's do the good work, okay? All right. Thank y'all so much. Okay, we're going back to our thing. Well, let me just jump back to this because I think there's a little bit of a misunderstanding on this, and I want to make sure that we get this exactly right. You know, our Do It for Baby Dogs Senior Center Edition is out now. The application deadline is December the 27th. You know, what we're going to do, we're going to award the top 4 county aging provider regions, each one of them. We're going to select one in each one of those regions that's going to receive $100,000 for their senior center. And so in addition to that, anyone at, you know, Tuesday, December the 7th will be the date that seniors are, you know, are from that date forward, I guess, to December 27th, you know, is the application date. And seniors will automatically, if you are fully vaccinated, meaning first shot, second shot, and your booster, you will receive a $50 prepaid Visa gift card. Everybody that registers will receive that. And then what we want is more and more and more of you to that, you know, especially to go get your booster shot. You know, I was watching, I don't know, CNBC or something like that this morning and everything, you know, about, you know, all the stock stuff and everything that was going on. And Jim Cramer was on there, and evidently he and maybe his wife both have COVID right now. He felt real bad about it and everything, but he was talking about the fact that how the symptoms weren't all that bad. The reason the symptoms weren't all that bad, and he was almost in tears, to tell you the truth, was he had been vaccinated. He said, I can't imagine what this would be like if I had not been vaccinated. And I've had all 3 of my shots, but I can't imagine how bad that this would be. And it's really, you can really get a taste for just how tough it truly is when you've actually got this. He said, I would have never believed it. I would have never believed how tough this is. But really and truly, I can tell from just even my symptoms that are relatively mild, I can tell just how bad this whole thing really truly is. So I encourage everyone to get your booster shot. It just comes out all over the place all the time. So in this effort, what we're trying to do here is target the elderly that we still don't have across the finish line, especially with your booster shot. So I guess that's really all I've got on it. Is that pretty well summarize everything? Basically, bottom line is, if you're fully vaccinated, you can pick up that $50. All you got to do is register. You know, with that registration and everything, we're going to get more and more folks across the finish line, or try to, in the promotion of it, and we're going to award 4 senior centers with a great big prize, a $100,000 prize, a great big prize, and we're happy to do that. On Friday of last week, we went to Matewan Grade School in Mingo County. Now, let me just tell you this real quick about this. They won the $100,000 check and the party for their students. And there we are with myself and the First Lady, the superintendent, and I think the principal and superintendent is principal of the school, and the superintendent on the right-hand side. Now, just think a second about this. That school was out that day. They did not have school that day. And yet the students, the teachers, all kinds of folks came at that school. The place was packed. The place was packed with students and teachers. They were standing around the walls you can't see in this picture. It was amazing, amazing. An area of the world really and truly that's been neglected in a lot of different ways. So we were really proud to be there. There's great big winner there and everything. And what an incredible bunch of kids. And what a really unbelievable staff and superintendent, the administration, all those people, all the teachers, the cooks and everything. It was just a great celebration day. And so, you know, there's so much goodness within this state. All you got to do is just get out and go. You know, I mean, this business of just sitting here in Charleston waiting on something to happen is, it just doesn't fit my mold. You know, I'm hands-on, and that's why I want to go. And so, so we were really proud to go, and we congratulate that school and congratulate that county, and absolutely, you know, the other thing is Communities in Schools is doing unbelievable work right there. They just went on and on and on about praising the site coordinator and all the stuff that Communities in Schools is doing right there. You know, it's an amazing program. And you know, I give Kathy a lot of credit and everything. Kathy's doing an amazing job with it, but in all honesty, just to be perfectly honest, we didn't know a lot about Communities in Schools. But now it's expanding all across the state, and it's touching tens and tens and tens of thousands of kids. And the goodness that's coming out of it, all you've got to do is listen to the teachers. All you got to do is listen to the people that are at the schools. And they would tell you probably the most amazing program that we've ever had in our schools. And so with all that, I thank Kathy, I thank all those that are doing that great work. But with all that, I'm telling you, this is a special day. You know, those people down there continually are telling me, thank you so much for coming and everything else. Well, I'll tell you just the bottom line of the whole thing. I'll promise you the giver is the one that always wins. If you'll just carry that thought, if you'll just step up and thank somebody, give somebody the time of day, create a warm meal for somebody, do something to reach out a helping hand, you'll win. And in my case, I'll promise you that day meant more to me than it meant to them, because literally, you can see it all over their faces. Those people are good people, and they deserve for any and all of us to try to help. Real quickly, a reminder, if you're 65 and older and you've got any symptom, get tested. Please get tested. The antibodies are there. Even though they're in short supply, they're there that can save your life. I encourage you, if you go out to a crowd, especially over these holidays, but if you go out in a crowd, please consider wearing a mask if you're 65 and older and you've got any health issues whatsoever. It's really probably something you really ought to really seriously consider. I can't tell you enough about getting your booster shot. I mean, absolutely. There is nothing in the world that I could think would be more silly than to take the time to get vaccinated 2 times and then sit around and believe that the weather's not going to get cold. It is. And believe that you are protected with 2 shots. You're not. You're not. In fact, if you're 6 months out, in all honesty and fairness as I could possibly be to you, you're practically not even vaccinated at all. And absolutely to sit on the sidelines and say, well, I'm not going to really get that booster shot right now. Bad mistake. We've got 64.3% of the 5 and older that have had 1 shot, 70% of the 18 and older, 81% of the 50 and older, and almost 91% of the 65 and older. You can see we're getting there, but we still got a ways to go. The vaccines are available to anybody 5 and older. I continue to ask our grandparents and parents to help me get more and more of them vaccinated. We just went through a real scare with our daughter-in-law, Kathy and our daughter-in-law. She had COVID. Probably, I don't know, maybe 6 or 7 months ago. She just had, our son and our daughter-in-law just had a beautiful 6-pound, 15-ounce little girl. And praise the Lord, she's healthy, she's doing great and everything. And then a few days after that, our daughter-in-law got sick. Her heart was racing, off to the hospital and all kinds of different tests and everything. and we think everything's okay. But the one thing that they centered on in a lot of different ways was the fact that she's a young person and had COVID, and they were concerned about potential damage to her heart. Now, praise the Lord, we think that's all okay. But really and truly, you're seeing it all over the medical community. Young people getting COVID. Even though she was vaccinated, getting COVID. And then all of a sudden from that, then the next thing that happens is all kinds of people in the medical community are telling horror stories about young people that are having heart conditions throughout all their life because of COVID. And so I would encourage you parents, listen to me, please. Get these young kids vaccinated. You need to get that done right now. All the free testing is up there. We thank Pruitt, we thank Walgreens for all that they've done over and over and over. Long-term care facilities, 41 outbreaks. We have no outbreaks in our church communities. That's great work and everything. 144 inmate cases and 38 staff cases. I encourage you about getting your flu shots. You can do it at the same time as the COVID shot. I encourage you, we're going to run out of this, we're going to run out of time on this renter money and landlord money. If you're a renter and you could possibly qualify for a financial hardship, we'll send you money. Landlords, the same thing. I encourage you about giving blood. I don't know that I've said that enough here recently, but really and truly, the Red Cross needs you to step up right now. Step up. I've said this over and over, and I don't know why I quit saying it, but if you have gotten COVID and survived it, you have been blessed beyond belief. You should really consider giving blood. Our TANF payments, the West Virginia Department of Health and Human Services will issue a one-time payment of $400 to the recipients of the Temporary Assistance for Needy Families program. That'll be going out, I guess the recipients of the Temporary Assistance for Needy Families program who were active in the WV Works program through the month of December 21st or 2021, are now eligible to continue participation in that program in January of 2022. Payments will occur around the 28th of this month, and DHHR is received the TANF emergency assistance funds as part of the COVID pandemic response funds, and they'll be going out the 28th of this month. There was a lady that we just lost in Beckley. I had the privilege to know this lady and know her very well. Her name is Madriff Chambers. She was 86 years old, and anybody that knew this lady, she kept doing and participating in everything coming or going until her death. I mean, she did so much, it's unbelievable. She was an African American, and just she was the first, I guess, black lady to be elected to the Beckley Common Council, and served as the Ward 5 representative for 12 years. To say that she worked tirelessly up to her death is an understatement of all time. You would surely not say that if you were, or you surely echo that time and time again over Madriff Chambers, because she was a fireball. So today I'm honored. I'm going to present her with the Distinguished West Virginian Award. And in fact, I'm sorry, I presented her with this Distinguished West Virginian Award in August of 2020. And so to Madriff Chambers and all of her family and everything, I can't tell you enough. I can't tell you enough. Anybody that has lived in Beckley, and I lived in Beckley a long time, anybody that's been in that area knows just what an incredible contribution that she gave to all those folks in the Beckley area, and so we'll miss her, and we need many more Madriff Chambers. That's all there is to it. Last thing I got is Bette Midler. I would say this, her song, that she sang and ever so well Wind Beneath My Wings. At my dad's funeral, I selected that we sing that song because I felt like that Dad was always that. And I think of her, maybe up until yesterday or the day before, I think of her in a good way. But absolutely, with her criticism of West Virginia, which is so uncalled for. You know, I would very well say that Bette Midler may have never been to West Virginia before. You know, she's a New York, Hollywood elite, that's for sure. She absolutely believes in things that are trying to take the very existence away from this country. You think about the propaganda to promote socialism throughout our country. And absolutely to step back because Joe Manchin is stepping up and doing what's right. That's just all there is to it. But Joe Manchin is just really representing West Virginia, is he not? I mean, it's tough to be a senator in West Virginia today and not hear the voice of the West Virginia people. And the West Virginia people are speaking very loudly. We stand wholeheartedly by our freedoms in West Virginia, but we stand wholeheartedly by the foundations of what this country was founded upon. We don't want our very existence stripped away and become average. Americans are not average. That's all there is to it. We dug in. We had grit. We just didn't sit on the porch and wait for things to just be divvied out equally amongst all of us across this country. The people that got dirty, the people that absolutely had grit in their life and everything, the people that strive to get ahead, that's the foundation of who we are. That's the very thing that made America the greatest nation on the planet and will continue to do so. But for Bette Midler to step back and say that West Virginia, and I want to get this, is poor, illiterate, and strung out. You know, now really and truly, and Bette, I hope you'll hear me loud and clear, because I'm a fair and I'm an honest person. Bette, it's cruel, and it's really, really unfair. You know, we've had a struggle, just like anybody's had a struggle. But just think about what we've done. In the last few years, we have now become the diamond in the rough that everybody's missed. We have the 4 most beautiful seasons on the planet. Absolutely, we have the very best people, and I would welcome you to come. I would welcome you to come and see these people. See these people that really care. People that love and appreciate others by what they do. You know, without any question, they're true craftsmen beyond belief. And through the last few years, all of a sudden, West Virginia has come to the forefront in item after item after item. We are producing surplus beyond surplus beyond surplus. Our pension funds are absolutely not underfunded. They're absolutely overfunded. Without any question whatsoever, in the best state of being that the state could possibly be, West Virginia, of all places, a state that is located within an area of this nation with an older population that has many, many chronic illnesses. A state that has gone through this pandemic and led the way in a lot of different things. But to say illiterate and poor and strung out is cruel and it's unnecessary. And I wish to goodness that you would make many, many open apologies for just doing that, because it's cruel. This state has become a leader, and this state produces the greatest people on the planet. A state that abounds in absolutely the most beauty beyond belief. And to absolutely sit back and try to throw mud at our U.S. Senator, Senator Manchin, and then throw mud at the people of the state of West Virginia is unacceptable. So that's all I've got.
Thank you, Governor. We'll now go to Dr. Clay Marsh, our coronavirus czar.
Well, good afternoon. And the governor has given us a tremendous amount to think about and to be thankful for the holiday season. I'm going to use my remarks here to try to help people understand where we are right now with the Omicron variant, both in West Virginia, in our country, and our world. So we have seen the Omicron variant of COVID-19 become the most infectious respiratory virus on this planet. And Tom Frieden, former director of CDC, says that this virus now, the Omicron variant, is acting like the measles virus does in a completely non-immune crowd. And is just as a reminder, the initial reproductive value, the number of people a single person would infect of the virus, the COVID-19 virus from Wuhan, China, was 2.3 to 2.9. The reproductive value of influenza is about 1.3 to 1.6. The United Kingdom variant, the Alpha variant, had a reproductive value of about 4 to 5. And that was the one that caused us to have the highest hospital spike in patients in the hospital in late 2020, early 2021. That peaked around 812 at that time. And it took about 3 months or so for the Delta variant, which is the variant from India, to take over from the United Kingdom variant in the United States. And at the time that Delta was circulating and took us to our very highest level of hospitalizations on September 24th to 1,012, Rochelle Walensky said that in all her years as an infectious disease expert, she's never seen a respiratory disease that has spread faster than the Delta variant. And again, it took about 3 months for the Delta variant to take over, competing with the United Kingdom variant. And the Delta variant has an R value of about 5 to 8. Well, it's taken 3 weeks for the Omicron variant to outcompete the Delta variant in the United States, which is just a breathtaking example of how incredibly contagious this virus is, and has an R value in a completely immune population related to previous infection with Delta and vaccination of the population we've seen, has an R value of about 3 to 3.5. So that means in an unvaccinated, non-immune population, we're dealing with a transmission value that is like the most infectious respiratory viruses that we've ever measured, like the measles virus. And what that means is that people need to be particularly aware of this spreading in the United States. 2 weeks ago, 3% of the US was the cases were the Omicron variant. 1 week ago, about 13% of the cases in the United States were the Omicron variant, the rest being the Delta variant. And yesterday it was reported that this week, about 73% of the cases, newly sequenced cases in the US, are from the Omicron variant. As we look at South Africa, we have found that the Omicron variant can spread in people that have been previously infected with COVID-19, and also can infect people that are greater than 4 to 6 months out from their second vaccine of Pfizer or Moderna. And as we go forward, we know now that it's really, really important for us to look at booster doses for those eligible being really part of that best protection related to the Omicron variant. When we look at the spread in a country more like ours, South Africa, a younger country, the area in South Africa that was really hit hardest with Omicron was one of the heavier vaccinated areas of South Africa. When we look at the United Kingdom, which is a place that we've looked to for much of the rest of the COVID pandemic, we can see that London is a center area that's seeing the most spread of the Omicron variant. And as opposed to what had been published in South Africa, which is that the variant appeared to be less severe in its manifestations based on a 29% reduction in adults needing to be hospitalized. However, in the same study, the South African experience reported a 20% increase in children being hospitalized. But as we go to the United Kingdom and particularly England, we're seeing that hospitalizations are also rising with more cases from the Omicron variant and have gone up by 20–25%. And several people now have died from the Omicron variant. We just had our first death in the US in Houston, Texas, an unvaccinated person who died of the Omicron variant. And in research from the government of England, they are saying that they have no evidence to date that the Omicron variant is less severe. In fact, it looks like it's just as severe based on symptoms and hospitalizations as Delta. And they are warning that people really need to take this variant even more seriously. As the governor said, our hospitals are full. He read a note from our hospital association. We see around the country a 20% increase in hospitalizations over the last couple of weeks and up to a 50% increase in hospitalizations over the last month. West Virginia hospitals are already fuller. We know that the Omicron variant is going to have a devastating effect on the transmission in the country, particularly in people that are not vaccinated, are partially vaccinated, and even in people who have been vaccinated but not boosted, who are eligible, the risk to them is significant to get sick and to end up in hospital beds. Our hospitals can't afford that. And so as we look at the Omicron variant coming to West Virginia, we have documented only 3 cases so far. And we know that one of the benefits that we have is we tend to be a bit behind other states that go in front of us. But all of our border states now are starting to see Omicron really start to become much more prevalent as a cause of spread of COVID-19. Hospital numbers are up at an all-time high in Ohio. The numbers have doubled in hospitalizations in Maryland over the last month. So we know that it's only a matter of time until the Omicron variant very much starts to affect West Virginia, just like it's affected other states around us and outside of West Virginia in in Wisconsin, Minnesota, Michigan, Connecticut, Rhode Island. Even Rhode Island, that is the most vaccinated state that we have in the country, is seeing a surge in COVID cases from the Omicron variant and seeing hospitalizations pick up. Really important that going into the holiday season, we're very careful and people choose to get fully vaccinated, and particularly people that are 6 months after that second vaccine, please get boosted. Also, our children have higher risk of getting infected from Omicron, and not only risk of having more significant illness, but also they are the ones that can spread it to other people. So it's a really important moment for us in West Virginia. We are seeing a viral variant that is more infectious than any variant we've seen so far in the COVID pandemic, with a 3 to 5 times as high a rate of spread as the Delta variant. And we know that the vaccines, unless you're completely up-to-date boosted or freshly fully vaccinated with that 10 to 14 days after the second vaccine, you are susceptible. And the CDC has now documented that people that are unvaccinated have a 10 times risk of getting infected, reinfected with COVID, even if you've previously had COVID infection, and a 20 times risk of dying, as opposed to people that are fully vaccinated and boosted. So it's the time, West Virginia, for us to run to the fire and pull the rope in the same direction, because our hospital system won't tolerate a huge surge. And with the Omicron variant, that is indeed what we will see in our country and in West Virginia in the next weeks to couple of 3 months. Thank you.
Thank you, Dr. Marsh. Next, we'll go to retired Major General Jim Hoyer, the director of our Joint Interagency Task Force.
Good afternoon. I'd like to reinforce a couple of things that the governor has continued to reinforce throughout this. One is our primary efforts are to reduce the number of deaths, the loss of life of good West Virginians, and maintain the integrity of our healthcare system. As he and Dr. Marsh both pointed out, we have significant concerns going forward, particularly in January and February, with potential challenges for hospital capacity. Today, the governor pointed out the numbers, but what I want to also highlight in those numbers is the number of ICU patients and number of ventilator patients, but also a number that we track daily is the number of admissions, and anything above 60 puts us at a significant challenge. And today's number was 78 admissions. So that means not only are we continuing to fill up hospitals, but unfortunately, we're losing West Virginians as those numbers fluctuate. The other thing I want to point out is as a result of the direction of the governor, we did conduct a tabletop exercise. We're looking at a variety of things that we can do and will continue to look at doing related to relieving pressure as we see Omicron and a potential next significant surge come our way. That includes everything from working with the National Guard and FEMA on manpower issues to looking for the availability of home health support and oxygen, working with our community health clinics on expanded hours and availability of services in those areas, as well as testing kits and a whole variety of other things, to unfortunately include making sure we have the appropriate availability of morgue space. Those are things that we have to look at in preparation for challenges that we may face. Another area I want to point out to West Virginians is we are also looking at how to best maximize the use of antibody treatments, particularly when there is a national shortage of antibodies. And most recently, we've now found that the Regeneron antibody treatment may not be effective for the new variant. So that is another reason why the governor's pressed so hard with our grand families as well as the senior program. And Jordan, if you could just put that slide back up again on our senior center initiatives. Want to make sure that folks in those centers, affiliated with those centers, get out and get those vaccinations, get those booster doses. It's particularly critical for West Virginians over the age of 50, and to participate in the prizes and the drawings. Also make sure that you register online, but it's exceptionally important that we reinforce, particularly over age 50, booster doses. So we've got to continue to work that significantly over time. I would leave you with this. Dr. Marsh continues to reinforce this to all of us. The best and most available treatment that we have is to get fully vaccinated, to include the booster dose, particularly with the variant we have coming. Thank you.
Great, thank you, sir. Next, we'll go to Dr. Ayn Amjad, our State Health Officer.
Good afternoon. I just wanted to remind everyone that the DHHR's Health Statistics Center is launching the electronic death registration system on January 1st. This was developed with funeral homes, medical certifiers, hospitals to help speed up the process of death certificates. We do want to reiterate, though, that we have a 60-day grace period where if people have not registered for it yet, that they are able to still submit paper death certificates. The purpose of this is to speed up the process of receiving death certificates. However, there could still be some delay in reporting, but having electronic records will definitely speed up the process. Some people might see it as referred to DAVE, which stands for Database Application for Vital Events. But if there's any more information needed, we're happy to push that out. But it's supposed to launch on January 1st, but you can still use paper ones as well. Thanks, Jordan.
Thank you, Dr. Amjad. Secretary Crouch is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Aaron Noon with Nexstar Media.
Hello, everyone. I am in for Mark Curtis today. He's off all week, so that's why you see me. But my question was actually for the governor. I was wondering if you were going to weigh in on the opposition of Senator Manchin and the Build Back Better plan. Some people are saying it would cause inflation, but on the other hand, it would really benefit West Virginians. So I was wondering what your stance is on kind of the whole thing. Thanks.
Well, Aaron, thanks a bunch. And I've already said this one time, but and I didn't really say this in direct response to like your question, but just think about just this. First of all, I think Senator Manchin's decision is the right decision. But I also think this. I think that West Virginia is doing well, and we're going to continue to try to turn every rock and help more and more and more of our people. Inflation is a really, really significant thing that we should really be concerned about. Just think, when we go to the gas pumps, or we go, with our heating oil in the winter coming up, or we go to the grocery stores and everything, if you just look around, you can see really very, very easily that things are really significantly higher. Well, that cuts right into the pocketbooks of all of us. But the thing that I say more than anything is just this. I think we have, with the Build Back Better plan, I can't imagine that we call it that, but with that plan, really and truly, it's just a movement. It's a movement across all of us and everything to basically turn us into a socialized society. With all of that, really and truly, it just flies right in the face of West Virginians. Senator Manchin really and truly listens to West Virginians, and he's got to. He's got to in his position. We cannot have a senator, a U.S. representative that we have in our senators. We cannot have them be non-representative of West Virginians. West Virginians believe, without any question, that this country is founded upon the right things that took us forward. The American dream, having the grit to really get after it, taking care of those that are having a tough time, and extending a helping hand. That's what we do in West Virginia. We do not absolutely promote programs of socialism. We do not do that in West Virginia. And we cannot be heard in that voice. And so I really believe that Senator Manchin is listening to all West Virginians. Absolutely, we want to continue to perpetuate West Virginia. West Virginia is on a great path. We have absolutely set it on that path, and without any question, West Virginia is going to continue on this path. So from the standpoint of my watch, I want nothing but goodness and goodness and goodness for West Virginia. If they could have come up with a program that absolutely made real sense without just throwing money beyond money and creating more and more of an inflation problem across this great land, and especially in West Virginia, then we may have absolutely been, all of us, we may have had the opportunity to be behind it. But they didn't do that, did they? They came with a program really and true that was inflated beyond belief. It was a giveaway program. It was a program that hurt West Virginia in so many different ways. It was unbelievable. But more than anything, it creates runaway inflation and absolutely, basically creates a bill that is so unnecessary for all of us, it's unbelievable. The generations to come would have paid and paid and paid and paid if, in fact, they would have been Americans. Absolutely, I challenge you with just this over and over. If you don't think our democracy is fragile, you're absolutely kidding yourself. We have made this country what it is today by our beliefs, and absolutely to deviate away from our beliefs and go into these silly no-man land stuff that is absolutely perpetuated by the Biden administration is going to absolutely lead to our decline in many ways. So no, I commend our senator for standing up, but I think he's standing up because he knows that that's what the West Virginians that put him in office believe. That's what we do believe, and so that's my thought anyway.
All right, thank you, Aaron. Next, we'll go to Bob Aaron with WCHS and Fox 11.
Governor, if you can hear me, we committed $48 million in federal pandemic relief towards the training of nurses over a 4-year period that you announced earlier. There's still quite a bit of those CARES dollars left, and a deadline is approaching. How do you plan to spend that money? And can you give us some idea of what exactly remains?
Bob, all the particulars, I mean, it just take too long to go through all the stuff right now. All the particulars will be coming out later and everything on the program and everything. I think you'll be really excited about what you see. It's a recruitment program to bring folks from other states here, but not only that, it's a holistic program on every part to be able to train, to be able to absolutely initiate these 3 additional universities or colleges and everything, or institutions to bring on more and more goodness in West Virginia. I think when you see it, you'll very quickly agree that it's a real need that we have. There's no question. The need is absolutely just right at our fingertips. These dollars that we've prudently managed would have reverted back to the federal government, and God forbid, and so with all that, we're using these Fed dollars to perpetuate our state and to make a safer and better state for all of our people, from the standpoint of being able to go to our hospitals, being treated properly and everything, and have our hospitals adequately staffed, and like I said, the multiplier effect of the dollars is real.
Great, thank you, Bob. Next to John Mark Shaver with West Virginia News.
Good afternoon, everybody. I want to talk a little bit about the Omicron variant. Maybe this is a question for Dr. Marsh. Over the past 2 years, I think people have ingrained assumptions about the virus in their heads, and I think Omicron changes that, but not for a lot of people in the general public. A lot of people I've talked to who have gotten both vaccines even and the booster still think they're fine with just that. And medical professionals say wear masks, social distance, and these people don't really see the necessity. So how does the Omicron variant change how people should approach the virus and the pandemic overall? Thank you.
Well, let me say this before we go to Dr. Marsh, and I had a hard time. I stumbled around pronouncing it, to tell you the truth, and the only thing that I could cling to was all the people that were making fun in the very beginning and said if you rearrange the letters of the Omicron variant and everything, you could come up with moronic. And well, we giggled a little bit about that in the beginning, did we not? But really, when it really boils right down to it, you're right. You're right in a lot of ways. We don't take it as serious as we should be taking it. I don't know how in the world we deviate from the fact of the expert, Dr. Marsh telling us that this virus is the most contagious virus maybe from way back when, and talking about the measles. And the measles swept across this country and took death after death after death, and literally we were panicked over it. So with that, I wrote down, and I always write down, what our experts are saying, as we go forward and everything. He says we're seeing a viral variant, the Omicron variant and everything, that is multiples of times greater in its infectiousness than the Delta variant. We were afraid of the Delta variant, were we not? And absolutely, this is becoming more and more of a situation to where we're afraid, but we survived. We're afraid, but we survived. But now we're not too afraid, and there's a lot of folks that are going to die. So, Dr. Marsh, please go.
Thank you, Governor. Governor, you are very much spot on. We have a situation, and this has happened with the 1918 pandemic as well, where, after a number of months, and now we're looking at coming up on 2 years, people are just tired of hearing about COVID-19, tired of dealing with it. Well, we are approaching 900,000 deaths in our country. We've gone well over 5 million deaths in our world. And we are faced with a form of COVID-19 that is more infectious than probably any respiratory virus we've seen in our lifetime that is spread in the way that COVID-19 has. COVID keeps getting more fit. And we know that people that are unvaccinated are all likely to come into contact with this variant, the Omicron variant, and very likely to get infected. And even people that have been vaccinated or who have had COVID in the past and have recovered, it's likely that they're going to get infected with the Omicron variant as well. Now, certainly having some vaccine in you, having the 2 doses is helpful in reducing your risk of severe illness, but not nearly as much as it used to be, which is why really getting that booster dose is so incredibly important. And if you haven't been vaccinated yet, please get vaccinated. But if you're eligible for a booster dose, we really want to see you get that, because nationally, only about 30% of people eligible have been boosted. And in West Virginia, it's about 32, 33%. And even in our most highly vulnerable group, are over 65-year-olds, 3/4 of the deaths in COVID-19. We know that only about 50% of West Virginians in that age group that are eligible have been boosted. So it's really an opportunity for us to save lives and maintain hospital capacity, because right now our hospitals are full. And the governor read that very heart-wrenching note from the Hospital Association and all the leaders of West Virginia's hospitals that see the same thing we do, that as Delta variant becomes more infectious in people that are, 6 months after their vaccines and haven't been vaccinated, which is what we've seen in other parts of the country and are likely to see in West Virginia, that gets followed up by the surge in Omicron cases, which we have not seen nearly the amount that places like New York and Connecticut, New Jersey, and many other states are seeing, but we will see it too. That 1-2 punch is going to be really, really dangerous for our hospital systems. And so right now is the time we really need to protect ourselves and each other. And that really provides us the best opportunity, as the governor said, to get through this phase of the pandemic. But we're dealing with a respiratory infection, the Omicron variant, of the likes that we have actually never seen in our lifetime. And it is going to be stunning how fast this thing spreads and how many people will get sick with this variant in West Virginia as well as in the country. I am very, very worried for the upcoming month to 2 or 2.5 months.
Thank you, John. Mark, next to Mark Cram with WDVM.
Well, good afternoon to everyone. Good to see you. Now that we're hearing more about Omicron being here, looking at a test result, is there a way that an individual can tell if they've caught the Delta or the Omicron? I think typically what I've heard and seen is that the test results generally say positive or negative and don't really show the individual which variant it is. Is there a way to tell what you've contracted, and would that be helpful to the patients? Thank you so much.
Mark, thanks a bunch. Dr. Amjad, can you do this one, please?
Yes, Governor. Mark, unfortunately, we don't have anything that will tell us right away if it's a Delta or Omicron. If you get a PCR test, it'll get sent out and it gets sequenced, and sometimes it takes up to 7 to 10 days, unfortunately. So we don't have anything that will mark it the way you were asking, unfortunately, but that would be very helpful. So we do just want people to self-isolate if they're pending tests or around people, and definitely quarantine if you're positive, because if it does come out later that you had one of those variants, of course, that's very important for us to know and make sure everyone has been contacted. But that's all. Thanks.
All right, thank you, Mark. Next to June Leffler with West Virginia Public Broadcasting.
Good afternoon, Governor and panel. So we know that 3/4 of new COVID cases in the U.S. are the Omicron variant. I don't see Omicron data on our dashboard right now. I was wondering if we could get a sense of how many cases have been detected, or how prevalent we think this Omicron variant is in the state.
June, I think I can answer it, and Dr. Marsh, you tell me if I'm wrong. I think we've got 3 cases in the state right now. Maybe that's why we're not showing it on our dashboard right yet and everything, but but it is exploding in all of our neighboring states, and everybody's watching. Everybody's really on top of it and everything. But Dr. Marsh, maybe you could, if there's anything else I missed.
You're exactly right, Governor. But just like we talked about with the Delta variant, and we talked about with the initial COVID that we were worried about, we know that Omicron is growing in West Virginia, just like it is everywhere else. Omicron does not respect any state boundaries or borders, or even national boundaries or borders. So it's only a matter of time until Omicron will overtake Delta in West Virginia as well. We always have had the luxury of seeing other states before us. And right now, there'd be no reason to put up the positive results from Omicron because we have so few that we've detected. But we know in the next weeks to months, the Omicron variant will grow very rapidly in West Virginia. Francis Collins, who leads the National Institutes of Health, believes that we will shatter all weekly records of new cases in the upcoming month to 2 months. And previously, our highest average has been around 250 to 300,000 cases, which was in early 2021. He's projecting we will see 500,000 to 1 million average cases a day when Omicron peaks in the country. But we know it's coming. We know it's growing in West Virginia, and we will start to see almost certainly the replacement of the Delta variant as we've done over the last 3 weeks in the country in West Virginia, and then posting that will be helpful.
All right, thank you, June. Next to Curtis Johnson with WSAZ.
Hey, thank you, Governor, for taking my question. Really interested about the announcement you made earlier with the nursing shortages and things. I heard one of the presenters say that there's 2,000 nurses in 4 years. I heard another say the program will start in the fall of 2022. Given the urgency of the Hospital Association's statement and the stats you presented, how can the state bring immediate help to the understaffing and replace those 1,700 nurses that left the profession? When will we realize the impact of today's announcement?
I think we've got two super experts with us right here, and you know, this gives them the opportunity to answer. So, Doc, maybe if you would answer this, please.
Sure, thank you, and thank you, Curtis, for the question. The impact, you're right, of this program will be over the next 4 years as we increase enrollment in our current schools of nursing. But we will be increasing that enrollment in both LPN programs, which are year-long programs, associate degree RN programs, which are 2-year-long programs, and bachelor's programs, which are 4-year-long programs. So that 2,000 will culminate over that course of 4 years. And that will be 2,000 nurses over and above the number of nurses that we are currently graduating in West Virginia. In terms of immediate relief, we are certainly working with our partners at the West Virginia Hospital Association, the West Virginia National Guard, to try and look at creative ways to bring that relief through education, which of course is our role. But the West Virginia National Guard and the Hospital Association are also working very closely to try and bring some of that additional relief through additional personnel.
All right, thank you, Curtis. Governor, I'll turn it back to you.
Well, I'd like to go back to Doc, just say, you know, from the standpoint of our recruitment, you know, aspect of this and everything. Would you like to maybe elaborate just a second on that? You know, maybe you know, to the last viewer or last question, maybe.
Sure. So part of this is going to be recruitment of nurses from other parts of the country, which of course is no small challenge given that this is a national shortage. But we do have some successful recruitment programs in West Virginia that we would like to see expanded so that we can bring nurses to enjoy the lifestyle of West Virginia, to enjoy what West Virginia has to offer. And we may be able to tempt some of those nurses to come and work in West Virginia as opposed to other places. So that recruitment into the state will be an important part of the solution as well.
Thank you so much. Like I said, a historic announcement today. I'm very, very proud to be part of it, and so many great people within our state have put in a lot of licks to make it happen. Really happy for these institutions that we're going to deal with and everything. But bottom line is we've got to some way, somehow, recruit more nurses to come to West Virginia. We've got to absolutely have more nurses in West Virginia where we're not having a 1,700, folks that didn't renew their license, and 68% of them just said, we're just worn out. We just can't do it anymore. I mean, that's just all there is to it. So with all that being said, we need to fulfill the need, and we're all about trying to do just that. So I think it's a great day for West Virginia in that. From the standpoint of other things that I'd just like to go over real quick is just this, is General Hoyer, said earlier, that what we try to do is monitor the number of hospital admissions that we get each and every day, and we try to keep that at 60 or below. And today we're seeing, or yesterday, I guess we saw 78 people be admitted into our hospitals. It doesn't sound like much, does it? But just think about it just for a second. How much of an increase really is that? And if you just look at what is 30% of 60, it's 18. You add that to 60, you've got 78. It's not quite 30% as an increase, but it's dadgum close. 30% of an increase in a day, it's really, really, really substantial. And so we got to watch. We got to really, really watch. From the standpoint of I tried to explain more in detail the Do It for Bay Dog Round 3, the Senior Center edition, from the standpoint that any of our seniors that are fully vaccinated and everything can register and pick up that $50 gift card. That's great. But the $100,000 going to your senior center, of those 4 around the state that are going to be selected, that's a big deal. That's a great big deal. And we give credit where credit is due. And that idea came from General Hoyer. And another great idea to get out ahead of this and try to help our people get across the finish line with their booster shots. So with all that, again, to Ann and Doc and all those that are making all the licks happen in regard to the recruitment and the education and everything, and more quality nurses within our state, and maybe a program that will blossom all across our country and everything, and satisfy a need that is really, really, really important. Again, I thank you, and we just got to keep at it, don't we? We just got to keep at it and absolutely keep pushing the right buttons, and that's what everybody here is trying to do. So thank you so much. Especially thank you all for being with me today. Thank you all.